And our next program that we will be starting here in just a moment, Lifestyle Medicine for Women, Bridging the Gap. Dr. David Kroska, thank you so much for being here. So we'll just give you a couple seconds just to get, oh, there we go. And as we're gathering, Dr. David Kroska is a board-certified obstetrician, gynecologist, and director of reproductive medicine at Centricare Clinic in St. Cloud, and as a full-spectrum provider of primary care for women over 38 years, coupled with the needs of infertility patients. And he also developed the Lifestyle, Food, and Exercise program in 2004 to practice preventative health care, as opposed to disease care, and the needs of his patients and community. So with that, I'll let him tell a little bit more about himself. We are very, very honored to have you, Doctor, so it's all yours.
Thank you very much. I want to thank me and Jen for all the work they've done to put together this amazing program. We've been richly fed both in mind, spirit, and body here today. I think that we have had spiritual dimensions to this presentation. We have had good food here to nourish our bodies, and I hope we have the good information to feed our minds as well. I'm going to build on the base of what we have already heard this morning. I'll be repeating a few things because this all comes from the font of knowledge out there. It's impressive to me how much we really do know about things, and I want to say that we've heard a lot this morning, and you're going to have continuing themes here, but we're going to also focus specifically much more so on items that are pertinent to women. This is a book. This is a cookbook that came out not long ago. The Caldwell Esselstyn, the cardiologist who study and book Prevent and Reverse Heart Disease, you already heard alluded to, his wife and daughter, the Esselstyns, wrote this cookbook here for women. Be a plant-based woman warrior. Live fierce, stay bold. Speak louder. All right, this is a great cookbook. I just found it not too long ago, and I tried some recipes out of there, and it's totally plant-based book. How are we doing? Better? Thank you. If you can't hear me back there, come on over here. All right, this bit about me here. Again, things I do. I teach medical students and I teach residents at our hospital, the family practice residency program we have. And they get taught 10 lectures a year about lifestyle medicine. We're hoping to kind of even think to incorporate a lifestyle medicine residency component to our training there. St. Cloud is also going to be the host to a brand new medical school beginning in 2025. The opening class will be 40 students, but we're on our way to becoming a place of education there as well. And I hope to be part of that. I'm going to sit down on the curriculum development committee and hopefully integrate lifestyle medicine as other good medical schools have done across the country. The LIFE program, this is something I've been doing. I kind of invented from scratch. This was something I put together in 2002. We had a pilot program in 2003. And then in earnest from 2004 on began teaching principles of lifestyle medicine. I was motivated to do this in part because of my interest in infertility and polycystic ovarian syndrome and managing high-risk pregnancy and taking care of women as they aged. So it kind of motivated me in many different ways, but it's pretty much the goals we've talked about in other talks here today. Clean eating, preventing and reversing disease, increasing health span, exercise, and wellness. The news this past week was some disappointing news about how the United States now is the last country of the industrialized countries of the world in life expectancy. Have you heard that? We're the bottom. We have the least life expectancy, and I'll also add to that the least health expectancy, health span. Health span is what this is all about. It's good to live to be old, but if you're old and propped up with 30 medications and stents and replacement parts, it's not the same. It's good to be older and healthy, having a good health span. We can achieve that by proven methods. I think that not everything can be helped or changed or reversed. Some things are too late when the cow's out of the barn. But point is that we can do a lot and not get there. Getting skips in the is this kind of running low on battery or something? Let's try that.
See if that'll help.
Try this.
Hello?
Hear me now? Better? I don't know. Not as echoey, at least. More volume?
Here, let me. Are we on channel A? Just a second. Keep talking. And
All right.
There we go. Keep going.
Our outline for today is these topics. We're going to talk about endocrine disorders unique to women, polycystic ovarian syndrome. I'm not going to roll too deep on that. I could talk an hour on that topic alone. Menopause, osteoporosis, autoimmunity conditions unique to women, and not always unique. Fibroids, a little bit, one slide. Cardiovascular disease, a lot of slides. And breast cancer, quite a lot of slides. So these are our outlines. We could add more to this, but women have unique risks, as you're going to see. Okay. Comment. Dr. David Katz is one of the thought leaders in the field of nutrition and medicine. He's out of Yale University, written a lot of good works. He's directed and been president of the American College of Lifestyle Medicine. He comments, he says, there's a massive base of scientific evidence spanning decades, outcomes, methods, and diverse populations supporting the fundamental principles of a health-promoting dietary pattern. We don't need to reinvent the wheel. We don't need a lot more studies. We keep getting more and more and more studies telling us the same thing over and over again. This week, for example, I read an article about a study done by the U.S. government, the NHANES, NHANES stands for National Health and Nutrition Examination Survey, NHANES, looked at 19,000 patients over a period of 10 years, looking at the issue of carbohydrates in the diet and risk of disease. Well, what do you think they found? That the less carbohydrates you're eating, the more disease you're going to get because you're eating everything else but carbohydrates. So those that have the low carbohydrate diets, call it keto plan or paleo plan or whatever other plan that's protein based, 15% greater chance of cardiovascular problems. If you were eating a high fat, low carb diet, 40% greater probability of cardiovascular disease. What we just heard already today, Brenda said that so well this morning. Here's David Katz, a book he wrote, The Truth About Food. Great book, very thick, but he answers a whole ton of questions people get all the time. The stuff like what you might find on the internet is, intermittent fasting good for you? Is the type of fat you eat important? Is cholesterol good or bad? I mean, all these kind of questions is clickbait. Good book to read. So what is lifestyle medicine for those who don't know? I know we're speaking to a group of mixed audience here, but it basically is a distinct field of medicine now which has, in fact, a board certification process. It has become the newest specialty of medicine. It's time we wake up to the reality of preventing disease, not just treating it. But we use evidence-based data and information to allow us to intervene to prevent disease. The provider acts as a medical expert. The patient is engaged. I can't tell people something good to do and expect they're going to have it done unless they go home and do it. I mean, it does require some patient engagement. It is cost saving, unlike allopathic medicine. Allopathic is the usual stuff. Prescribe and operate. That's allopathic medicine. And allopathic medicine has a place. We're never going to get rid of that, but we can prevent a lot of that problem. This is from National Geographic here. It looks at the U.S. healthcare costs and also our life expectancy. This is about 4 years old or so at this point in time here, but the red line is the United States. And just to interpret the graph here, the cost is the red line. We spend a lot more money on healthcare in the U.S. than anywhere else. All the blue lines are countries that have universal healthcare coverage. Now the life expectancy is way over on the right. So all those blue line places have more life expectancy and we have the lowest life expectancy. So we're spending the most, getting the least for it. Something's wrong with this picture. The Global Burden of Disease Study, which was alluded to earlier, Bill and Melinda Gates did a huge funded study around the world. I think it was something about 95 countries and 154 million people, I believe, or sort of surveyed to look at what are the reasons for people getting sick and dying. What's causing people to miss work or retire early or die sooner? What do you suppose the number one cause was? And it's a whole list of things they looked at. Drugs, harms, suicide, violence, malnutrition, smoking, alcohol, drug use. Huge list of factors. What do you suppose number one on the list was? Diet. Diet is killing more people in the world, not just here, but everywhere. But the diet is the diet we're talking about that people are eating, that we're exporting to them. It's our commercial, corporate food diet that they're dying of. This I'm going to refer to, a good resource. How many of you have heard of nutritionfacts.org? Quite a few of you have. Good. And those you haven't, you take a note. Nutritionfacts.org is one place you can go at online which has valid, evidence-backed, wonderful information for you. Okay? They review over 10,000 studies a year, team of professionals, and they really do the vetting. They look at the study and not just in isolation, but how does it compare to other studies of the same question? What is it telling us good or bad about cholesterol or whatever the case may be? Fantastic resource. Little short videos. I'm going to show a couple to you here today from that resource. Okay, endocrine disorders in women, polycystic ovarian syndrome, and menopause. Polycystic ovarian syndrome, for those who haven't heard it, affects about 7% of women. I'll show you a slide on it in a moment here, but what happens is that the cysts on the ovaries, on the right-hand side, those are, looks like Swiss cheese. Those are eggs or follicles that are semi-turned on, but then they arrest. It's a disease, what they call arrest of follicular maturation. The follicles don't keep on going to become a ripe egg and release. They just sit there. Because they've been turned on, they make hormones. So what do you think happens? You got too much estrogen and too much male hormone, both. And consequences. And as part of that disorder, insulin resistance, you've heard that already today. Insulin resistance is a key concept. What goes wrong? Again, 7% of women. There's an ultrasound picture. You can see all the little black circles over here. Those are follicles that are sitting there. They call that appearance a string of pearls appearance. It's rather pathognomonic or classic for this disorder. Because of excess hormones, they have more tendency to have oily skin, acne, hirsutism, growing hair, infertility, they don't ovulate regularly, and have significantly increased risks of both uterine and breast cancer. And 80% have insulin resistance. Got to get this on.
Both prediabetes and type 2 diabetes is caused by insulin resistance, which is now accepted to be closely associated with the accumulation of fat within our muscle cells. This fat toxicity inside our muscles is a major factor in the cause of insulin resistance and type 2 diabetes, as it interferes with the action of insulin. I've explored how fat makes our muscles insulin resistant, how that fat can come from the fat we eat or the fat we wear, and how all fats are not the same. It's the type of fat found predominantly in animal fats relative to plant fats that appears to be especially deleterious with respect to fat-induced insulin insensitivity. But this insulin resistance in our muscles starts years before diabetes is diagnosed. This is a graph of fasting blood sugars in the 13 years prior to the onset of diabetes. Insulin resistance starts over a decade before diabetes is actually diagnosed, as blood sugar levels slowly start creeping up. And then, all of a sudden, the pancreas conks out and blood sugars skyrocket. What could underlie this relatively rapid failure of insulin secretion? At first, the pancreas pumps out more and more insulin, trying to overcome the fat-induced insulin resistance in our muscles, and high insulin levels can lead to the accumulation of fat in our liver, called fatty liver disease. Before diagnosis of type 2 diabetes, there's a long, silent scream from the liver. As fat builds up in our liver, it becomes resistant to insulin too. Normally, the liver is constantly producing blood sugar to keep our brain alive between meals. As soon as we eat breakfast, though, the insulin released to deal with the meal normally turns off liver glucose production, which makes sense since we don't need it anymore. But filled with fat, the liver becomes insulin resistant like our muscles, and so doesn't respond to the breakfast signal, and so keeps pumping out blood sugar all day long on top of whatever we eat. So the pancreas pumps out even more insulin to deal with the high sugars, and our liver gets fatter and fatter. That's one of the two twin vicious cycles of diabetes. Fatty muscles in the context of too many calories leads to a fatty liver, which leads to an even fattier liver. This is all still before we have diabetes, but then the next vicious cycle starts. Now, fatty liver can be deadly, so the liver starts trying to offload the fat by dumping it back into the bloodstream in the form of something called VLDL, and that starts building up in the cells of the pancreas that produce insulin in the first place. So now we know how diabetes develops. Fatty muscles leads to a fatty liver, which leads to a fatty pancreas. It is now clear that type 2 diabetes is a condition of excess fat inside our organs. The only thing that was keeping us from diabetes, from unchecked skyrocketing blood sugars, is that pancreas, was working overtime, pumping out extra insulin to overcome insulin resistance. But as the so-called islet or beta cells in the pancreas are killed off by the fat buildup, insulin production starts to fail. And we're left with the worst of both worlds, insulin resistance combined with a failing pancreas. Unable to then overcome the resistance, blood sugar levels go up, and we have type 2 diabetes. This has implications for cancer as well. Obesity leads to insulin resistance, and our blood sugars start to go up. So our pancreas starts pumping out more insulin to try to force more sugar into our muscles, and eventually the fat spills over into the pancreas as well, killing off the insulin-producing cells, and we've got diabetes. In which case, we may have to start injecting insulin at high levels to overcome the insulin resistance, and these high insulin levels promote cancer. That's one of the reasons we think obese women get more breast cancer. It all traces back to fat getting into our muscle cells, starting insulin resistance, fat from our stomach or fat going into our stomach. So now it should make sense where the American Diabetes Association also recommends reduced intake of dietary fat as a strategy for reducing the risk of developing diabetes.
So that's the physiological explanation of what goes on. Fat in our muscles, fat in our liver, pretty soon your pancreas gives out and you got real full-blown diabetes. And you can reverse that, by the way. There's many programs out there for reversing diabetes. In fact, Brenda Davis, who spoke this morning, she has a book called Kick Diabetes, and it's an excellent book on the topic. So people can reverse their diabetes. I've seen it happen. I'll give you just a short thumbnail sketch of one person. Her name is Susan. I've taken care of her all of her life. I watched her get fatter and fatter and fatter, and she delivered a baby with PCOS, so we gave her a treatment for her not ovulating. The only child they've ever had. But she got to the point she became diabetic. She was diabetic under the care of endocrinology on 3 things, on insulin, Januvia, and metformin. And still had a hemoglobin A1C of almost 10. Was not well controlled. She was about 300 pounds. Developed diabetic neuropathy. Her legs were purple and burning and causing pain for her. Is she diabetic enough for you now? Is she really diabetic? Not borderline? She's really diabetic, okay. So we came through the LIFE program like 3 times, and she dumped whole food plant-based diet. She lost 173 pounds over time, and in a year and a half later, her neuropathy went away. She got off of all the drugs, including her medications for cholesterol and for high blood pressure. So she was taking quite a packet of pills every day, kind of like the story you heard this morning already, but who was that, Casey or somebody? Carlos, yeah. But yeah, like that same story. Unbelievable what a whole food plant-based diet can do to save your body. So this is just a show of more insulin resistance here. So polycystic ovarian syndrome, the answer to this here is to change what we eat and what we do. We don't want to be increasing or augmenting insulin resistance. You want to combat that at the cellular level. Not all patients that are polycystic are obese or overweight. There are some thin ones, but they still may have insulin resistance, unfortunately. So for fertility purposes, we often treat them with metformin to correct that problem enough to get them pregnant. But you can also correct it by diet and lifestyle. I don't have a slide on this, but there was a diabetes prevention trial that came out that's classic. It took people who had pre-diabetes and early diabetes and put them on either metformin, diet and lifestyle changes, or do whatever you did before. Guess what happened? Who won the contest? The drug people or the diet people? You know what I'm going to say. the diet and lifestyle people have 58% better improvement in their parameters than the folks taking the medication. So medications aren't all the answer. We need dietary change. Same thing is true for polycystic ovaries. This is a diagram of what fats look like. They're long chains of carbon. The C is a carbon atom with hydrogens attached to them. A saturated fat is up there. What's bad about that? Well, saturated fat, first of all, you've heard already, comes from animal origins. There's not too many plant origins of saturated fat. There's some, coconut oil being one, chocolate and chocolate liqueur being another. But most saturated fat comes from animal products. It's mainly from fatty meats. And even that chicken you buy in the store, that boneless, skinless chicken breast, it doesn't have hardly that much less saturated fat than beef does. Plus, if you're relying on your chicken for your source of vitamin B12 for your nutrition, you're out of luck. Your chicken was grown in a box, in a cage, in a factory. It does not see dirt and doesn't get dirt-containing vitamin B12 bacteria in its diet. So your chicken is vitamin B12 free. You will become deficient in vitamin B12 eating a chicken diet. So be aware of the fact that B12 is a good thing to take. I'd encourage that, and vitamin D for everybody. So here you go. These folks should be avoiding meat and dairy, saturated fat, fish and eggs especially, cholesterol, I'll come back to that in a minute. Also high glycemic foods, the refined things, the white things. As they said a long time ago, the whiter the bread, the sooner you're dead. So sugar, white flour, anything, be it muffins or cakes or most cookies, not the good ones back here today, but we should avoid. You should be eating more legumes. They work to help improve insulin resistance. We'll talk about the microbiome shortly. We talked about it previously. But eating high fiber and legumes feeds a healthy microbiome, the germs that live in our gut. And they actually improve insulin sensitivity. That's the bonus. There's things they're making, those good healthy germs are making, that improve our insulin metabolism. Wow, that's a good deal. So eating the right stuff. And obviously exercise. Who doesn't benefit from exercise? If you use your muscles more, they get more efficient at using insulin and sugar and glucose. Menopause is not just an expiration date. It may be the beginning of the best part of women's lives, really. It's not a bad thing. You end up having babies at that point in your life, but you got a whole life ahead of you. Life expectancy these days is, 78 for women average? And if you're a plant-based eater, probably 88. You get about 10 more years out of eating a good diet and living the right lifestyle. Definition, no menstrual period for over a year. Loss of ovarian function, of course, is the key. What happens? You don't make eggs, you don't make hormones, not estrogen-type hormones. You may have, not everybody does, vasomotor symptoms, including night sweats or hot flashes, vaginal changes such as dryness, urinary tract symptoms, urinating more, shrinking of the bladder. Mood changes and depression are more common after menopause, but only transiently for most people. Vasomotor symptoms. We find that they're much less prevalent in whole food plant-based eaters. Interesting. The Japanese on traditional Japanese diets and also the Chinese on traditional whole food plant-based eating have about 80% less vasomotor hot flashes than we do here. About only 20% of the population claim to have any hot flash problems, but 80% of our population will have that as they experience menopause. Phytoestrogens are compounds like isoflavones and soy, and I'll show you a little table of phytoestrogens here in a moment here. There are quite a few of them in different kind of food types, but these are products that are not estrogen. The word sounds bad, phytoestrogens. Since soy contains phytoestrogens, does not it cause cancer? And the answer is no, it does not cause cancer, quite to the contrary. But phytoestrogens do offer some protection for both vasomotor symptoms, and maybe why those living in the Orient have less hot flashes, because these compounds probably block some of the effects of what estrogen was doing in the body. And also has selective estrogen-like benefits in places like bone. And we'll talk about osteoporosis later. So about 30 to 40% of people have bacteria in their colon, good bacteria, the healthy kind, that convert phytoestrogens, one of them in soy called daidzein, into equal, which is even more potent to prevent hot flashes. So eating soy may be the ticket for about 30 to 40% of people not to have hot flashes. These things in the bottom here are a bunch of chicken wire diagrams. Shows different products in foods, phytoestrogens in general, and their origins. I'll come back to that in a moment here, but estrogen is way on the right in the box over there. You can see some of these have a kind of a similar look to estrogen, although they're not estrogen. They do not have estrogenic effects like, for example, causing cancers. Here we go. There's a book I read not long ago. This is actually an OBGYN doc who gets it mostly right. And it's not so much a plant-based person as to talk about the whole picture of menopause, but it's actually got some good stuff in it. But this is isoflavones from soy, coumestans from different things. But notice the foods they're coming from. These are things that can help your bones and help your hot flashes and help you go through menopause. What are those foods over there? They're legumes. It's soy. It's split peas. It's flaxseed. It's whole grains, fruit, vegetables, sesame seeds, legumes again, and red grapes. Red wine was on there, took it off, by the way, because we now find that women drinking wine regularly have more breast cancer. The U.S. government is close to the point of putting labels, warning labels on alcoholic products to say they are cancer-causing, because there's enough evidence not just about breast cancer for women, but also for men, certain cancers, esophagus and stomach, for example. So there are pharmacologic things you can do for hot flashes, for menopause. Clearly you can replace estrogen, but it comes with risks. You can't just take a large dose. You don't want to take it forever. It's not for everybody. There are people that shouldn't have contraindications to taking it. It's generally not used much anymore because we found through the Women's Health Initiative study, WHI study, that it increased the odds of breast cancer a little bit, also cardiovascular disease. But when you look at the real numbers, when I tell you there's a 29% increase in breast cancer risk, look at the actual numbers. We're talking about 3 more people per 1,000 users per 5 years. Now, does 3 per 1,000 per 5 years of use sound like a huge risk to you? It doesn't to me. I mean, I think we threw the baby out with the bathwater. I'm not advocating estrogen for people, but there are some people whom it might be a good idea. I mean, we're all different. What if you're super high risk for osteoporosis and you got osteoporosis already when you're 52 years old? It may or may not be a bad idea. So individualizing that decision is what needs to be done about estrogens in general. So we talked about WHI data, those numbers. Topical estrogen is a different story. Women may have difficulty with vaginal dryness, and intercourse may be painful and uncomfortable. I had a patient this past week here that I've known for a long time. And it's not a happy story. She hadn't had intercourse for 15 years. She had a hysterectomy about 2007. And because of that and her vaginal shrinkage and dryness over the years, not using the vagina, she had intercourse and she ruptured the top of the vagina. Had to have surgery to repair it. So things do shrink if you don't use them. I guess that's probably goes without saying. That's not a very common problem, by the way. But I'm simply saying that, yeah, we can do vaginal topical estrogen to help people who are sexually active not have the discomfort that may be there in menopause, because not much of it is absorbed systemically. It does not have identical risks to the systemic estrogen using group. There's a new product coming out. I mentioned, put it up here, this fezolinetant, which is close to FDA approval right now, which works in a different way to stop hot flashes. So for folks that have severe hot flashes that on to other ways, this may be a good drug for them. It's, again, so soon will be coming out, I'm sure what the trade name will be. Supplements, people have tried a lot of stuff to help with hot flashes, menopause, like black cohosh was tried for a long time, but the studies in that don't show that it works all that good. It's really kind of no better than a placebo, basically. There are some that do, though. For example, fenugreek may be beneficial. Siberian rhubarb has some data that's more positive than negative. Obviously, eating phytoestrogens, like I mentioned already, soy products, probably beneficial, especially if you take soy over the long time. I'm not sure going out and buying isoflavone isolated supplements is going to take care of you. I would not advocate that in general. I think it's kind of the American answer. The quick, cheap answer, put it into a pill and sell it. I think taking soy as it comes out of nature, eating tofu and edamame and soy milk and tempeh, and those would be the places to get your soy and phytoestrogens from, especially if you do them over a longer period of time. Osteoporosis. We've talked about that a little bit already, but about 1 in 3 women over 50 are going to get a fracture. That's significant, about 33%. There are factors that accelerate bone loss. The keto diet, for one. Loss of estrogen, of course, is key and why it becomes more prevalent after menopause. Certain medications, folks taking steroids chronically causes bone loss, or heparin at significant doses chronically would also be a risk. Excess sodium in a diet, the American diet, promotes excretion of calcium, so we are kind of shooting ourselves in the foot by eating all the salty foods. And oxidizing foods also are bad for bone. You know, when Brenda Davis talked about her bone density studies, and when I says, yes, I can almost see why her bones were so healthy. Because we know on the one hand, bone is a live tissue. It's growing. It's breaking down, recycling. It's also building up at the same time. So giving your body the ingredients for the building process, protein, calcium, vitamin D, for example, only goes so far. You got to stop the breaking down process. It's kind of a balance question. Which way is your balance going, up or down? And the breakdown process happens, the body uses a tool called free radicals in the osteoclasts. The cells that break down bone are called osteoclasts. And free radicals are like the chisels the body uses to chisel down the bone to get rid of it, to break it down, recycle it. Well, osteoclasts are slowed down, and free radicals are neutralized by a plant-based diet. You can stop the osteoclastic activity by eating more antioxidant-type rich foods. So that plus adequate protein, calcium and vitamin D, it only appears that getting enough is sufficient. I mean, giving people high doses of calcium and high doses of vitamin D has been shown to not make much difference. It does not change the fracture risk. So it's not just the answer. We do it because you need a sufficient amount. But more than a sufficient amount is not necessarily going to get you there, because there's more to the story. Other bone beneficial measures, exercise, obviously exercise. When you put force on bones, when you have resistance, they get thicker, they get stronger. It's like, well, our muscles get stronger, but the muscles are attached to bones, aren't they? So the muscles there are making your bones get stronger by putting force on them. Again, adequate calcium. Vitamin K, we used to think vitamin K because vitamin K allows you to take calcium from your blood and get it into your bone. It lowers your blood calcium a little bit. Good idea, seems like a logical thing to do, but the studies have not shown it to help. It has not really been shown in good studies to benefit bone density. So taking vitamin K or vitamin K2 or whatever brand you want has not been shown. Soy isoflavones, again, a goal would be to drink about 2 glasses of soy milk a day, be a good suggestion. Again, it has a selective effect on bone receptors, estrogen beta receptors. Estrogen hormone only works when it attaches to a receptor somewhere. And the receptors are either alpha or beta. The alpha are found in your breast and your uterus. The beta are found in bone. So again, soy is selectively helpful for bone and does not hurt the breast. To the contrary, I'll show you in a moment here, get back to breast cancer topic, it prevents breast cancer significantly. So it's working to kind of like occupy a slot that estrogen would occupy. Almonds decrease osteoclastic, curiously enough, just half a cup a day. Prunes have been shown in an independent study to help. By the way, dairy has never been shown to help bone. The dairy industry has never ever said milk is good for your bones. Anybody heard that? You haven't heard that. It would be a lie. Okay. What do they advertise? Does your body good. To make it nebulous. What part? Your toenails? I don't know, but it does not do your bones any good. Okay, so dairy is not an answer. Strontium, curious enough, has been published data. One study I saw on that showed that people taking strontium supplementally was about as effective as taking Fosamax, about 70% better than Fosamax. So strontium could be part of the answer. I think the jury's out on that one, but I'm just going to report it here because it's out there. There's a guy who wrote a book, I won't name his name here, at The Plant Paradox, who says you want to get rid of phytates and lectins because they're anti-nutrients and they prevent you from absorbing calcium and they're bad for you. Don't eat any legumes. By the way, don't eat tomatoes or eggplants or peppers or a whole list of foods that might get you in trouble. Is he right or is he wrong? Well, go to nutritionfacts.org and look at some videos on the topic because it's kind of covered very well there. But in point of fact, he's wrong. It's wrong. Phytates, it turns out, have, in bold letters up here, an anti-resorptive benefit, almost like Fosamax. So you want beans in your diet and seeds, whole grains. Things that contain these things are good. Also reduces cancer risk. If you are cooking beans from scratch, we do recommend you soak and rinse them before you cook them. It removes some of the excess lectins before you process them. But what's left there is good for you. Autoimmune disorders, thyroid disease and inflammatory bowel disease. Interesting new research on these two topics. Let's go over just basics of thyroid disease. some of you may have heard of it or have it. There's Hashimoto's and Graves' disease. Basically what happens in this disorder, like all autoimmune diseases, the body makes antibodies against itself. Your body's attacking itself. Like in arthritis, rheumatoid arthritis, your joints are being attacked. Inflammatory bowel disease, it's your colon or your bowel. In your thyroid disease, of course, it's your thyroid being attacked. And speaker this morning with diabetes had hypothyroidism. Not surprising, because those folks who get type 1 diabetes often have antibodies that cause that to start with, but they also can make antibodies against their thyroids as well. Not uncommon to have the two together. So Hashimoto's is a slow cook process. You gradually get it because your body's attacking the thyroid, but it's slowly attacking it, and it just gets less and less functional. Pretty soon you got to take thyroid replacement for it. It burns out. Graves' disease is kind of the rapid cook disorder where your body really goes after the thyroid, and it makes it really hyperthyroid. You put out a lot of extra thyroid hormones, and you get a whole bunch of side effects. Like, for example, you feel hot all the time, you get diarrhea, your whole body's turned on high. Your whole metabolism turned on high. And the eyes may begin to bulge, called exophthalmos, for example. There's a list of things that can happen there. So it's got to be treated more of a medical emergency. Obviously, at some point, that person's thyroid's going to burn out as well and need to be on thyroid replacement. So just how you get there, both kind of the same idea, just how fast they happen. They're both linked to excess estrogen, also linked to the fact that women are women. Somebody has postulated that since women have 2 X chromosomes and men have only 1 X chromosome, some of the genes that code for the immune system are on the X chromosome, it turns out. And if you're a woman, you got 2 genes that have genes for that autoimmunity potential. The potential is higher in women. As I said already, in women, it's like 10 times greater in women. I mean, think about that, 10 times higher. That's a lot. And estrogen may be a factor. So if what you might do to modulate estrogen's effects in the body, would it help this maybe be less probable? And the answer is yes. Curiously enough, the genetic issue, how genetic it is, Hashimoto's, they looked at identical twins in a study. Identical twins only about a half of the time. If you're identical twin, you only got about 50% chance of getting Hashimoto's if your other twin pair got it. So it's not that genetic. Maybe it predisposes you, but it doesn't mean you're going to get it. So like it says here, genetics may load the gun, but environment pulls the trigger. So much less prevalent in those eating a whole food plant-based diet, about half as common. Vegetarians, significantly less thyroid disease. Methionine is an amino acid found in meat, and it's a sulfur-containing amino acid. It's also implicated in cardiovascular disease in a big way. So methionine is a culprit. The highest food containing methionine is tuna fish. So if you're on a tuna fish diet, be careful. Might get mercury poisoning as well. I had a gentleman on a life program a few years ago, came back to see me, and I said, anybody taking my program can see me. You're welcome to come see me for a free visit or follow up on the program and see how you're doing. So Harold come to see me and said, I'm doing great. I'm eating all the right foods, and I lost weight and things are looking good, but I just can't, my memory's not working very well. My brain's not functioning. I'm forgetting things. And I said, what are you eating? Give me an idea what your dietary looks like here. Well, I eat a tuna fish sandwich every day. I said, do you mind if I check you for mercury? We did. He was toxic on mercury. That's why he was losing his memory, because there's a lot of mercury in tuna. It accumulates over time. And so we got him off the tuna fish. I think he got better over time. So methionine, though, is big in tuna. It's big in meat, getting off those sorts of foods. A whole food plant-based diet also increases your microbiome health, more Prevotella, more Bacteroides, more of the healthy germs you want to grow there, and therefore less immunity. High fiber alone decreases estrogen. Why? Because the body secretes estrogen, it metabolizes it in the liver, and sends it out with the bile. It goes into your intestine. But your intestine can reabsorb that estrogen back into your system, and you got it back again. But if you have a high fiber diet, the high fiber, especially soluble fiber, latches onto that estrogen and the bile, and it goes out with your poop. So in essence, eating a good diet kind of downloads some of the excess estrogen in the body, which helps improve your autoimmunity risks. See the connection? Things are coming together in a fun way. Inflammatory bowel disease, there's methionine up there drawn out schematically for your chemistry freaks. But both Crohn's disease, ulcerative colitis, greater incidence in women, significantly more than men. Food links, we've known for a long time, saturated fat, you know where that comes from. Total meat, especially methionine I mentioned there, metabolizes by those bacteria to hydrogen sulfide, which is toxic to your colon cells and may lead to the so-called thing of a leaky gut. So the more methionine you eat, the more leaky gut you might get. Yersinia is a bacteria that you make eating certain foods, pork in particular. And turns out food emulsifiers are a problem. These are things that are added to fatty-like things to keep them kind of uniform. And you'll find them in ice cream, Cool Whip, cottage cheese, and Crisco. And you eat more of these kind of things, and you will have a big negative effect on your gut bacteria. Sucralose, artificial sweetener, and use of NSAIDs, so ibuprofen-type drugs chronically, can have an effect. So, how do we treat inflammatory bowel disease with diet? I want to say just at this point in time here, there's been some striking studies in the past 4 or 5 years. This is really new stuff. The usual ways of treating inflammatory bowel disease are using things to turn off the immune system, steroids, for example, or taking biologics, these drugs like Humira, for example, which cost you $50,000 a year, and give you about a 50-50 chance it's going to take care of your problem. Well, in Japan, they treat inflammatory bowel disease primarily with diet. They put them on a whole food, plant-based diet, eliminating those things we talked about, and they get really good results. The British are also right behind the Japanese. They did a series of studies that are out there. I saw some video about 2 years ago now at the Plantricians annual meeting. There's several really good meetings for healthcare providers. One is the Plantrician organization. They showed some video from a GI clinic in London where they had put people on plant-based diets that had florid ulcerative colitis and Crohn's disease. But it was amazing to see the video, the actual photography of the colonoscopies to see what they were before and after. They took these really rugged, horrible, inflamed, ulcerated colons, come back 6 months later, and they'll look like a normal colon, just based on dietary change. It's striking to know that diet has that power in our guts. Or you can take the $50,000 a year stuff, too. Soluble fiber is one of the better forms of fiber. There are two kinds, soluble and insoluble. Insoluble fiber would be like bran or sawdust or something like that, just kind of goes right through you. Not doing any sawdust, but soluble is found in things like, for example, oatmeal and in little list in the bottom of the slide here. Dried beans, oatmeal, oat bran, pears, Brussels sprouts, citrus fruit, eggplants, and dried fruit are some of the higher sources of soluble fiber. It's what makes your oatmeal slimy. It's the soluble fiber you're looking at. That's the stuff you want to get in your diet. But we know that by eating this, more of this here, we're going to have more of this loss of estrogen that we talked about already here, how you can get rid of excess estrogen. The forgotten organ, it is an organ. There are more bacteria in our body than we have cells in our body. Did you know that? There's about 100 trillion bacteria living in us. And you don't need to get rid of them. You want the friendly kind, though. And that's the whole deal. It's well established what we eat makes a huge difference about that. We need to feed them the right food, so-called microbiota, accessible carbs, things that are used by the bacteria. The World Health Organization made a comment when we first figured this all out a couple years ago, said that this is probably the most important discovery in nutrition in a decade, that we need to feed the microbiome. We need to feed them the right products. And kind of a curious thing I found out along the way in talking to my lactation nurses at the hospital. Did you know human breast milk has about 8% of its content, about 10% left, let's say, of indigestible carbohydrates? It doesn't feed the baby at all. It's wasted space. Why would God do that? It's not wasted space. Those carbs are there not to feed the baby, but to feed the bacteria. Babies need that so their bacteria don't cause them to get infantile diarrhea. You're going to survive better as a baby if you've got the good bacteria growing. So breast milk is feeding your bacteria from the day one. Shouldn't we feed our bacteria? I'm thinking we should. Also, curiously enough, we talked about protein already. What are your protein needs? How much protein do you have to have? Let's forget what Americans are thinking they have to have. How much protein is there in human breast milk? Now, we're going to grow a newborn baby. This baby's going to have to grow a brain and a body and muscles and have all the energy it needs. Do you think the Mother Nature would say, okay, fine, the more protein, the better? How much protein does that baby need? 10%. 10% of the calories in breast milk is protein. Only 10%. Okay? So what do the blue zones people in the world we talked about earlier eat? 10%. Isn't that a curious thing? If your protein intake is 10% of your total calories, probably where you belong. Interesting. Legumes. This is what they do that you don't know they did. The healthy bacteria make butyrate, short-chain fatty acids. Look at all the arrows going to different things, your liver, your colon, your muscle, your fat cells. And look at all the lists of benefits that these things have. These healthy bacteria provide us a huge amount of blessing in terms of keeping us healthy and functional. Look at the liver. Reduced inflammatory mediators, enhanced antioxidant systems, increased beta oxidation, reduced lipid or fat deposits because of bacteria helping us do that. How do you not get the right bacteria in your gut? Eat the American diet. You'll feed the wrong bugs, they'll take over. So feed them whole, minimally processed grains, seeds, whole fruits, etc. Resistant starches, two things you got to have for the right bacteria. Fiber sources and starches. The right starches, again, are the key thing. One slide on fibroids. Women get this, men don't. I thought I'd throw it in here because it's interesting to me. A lot of what we do in gynecology is take care of fibroids and their complications. It's the #1 leading cause for hysterectomy in our country. It can cause real problems with hemorrhage, with bleeding, with pain, with the sheer size of them. About 2 weeks ago, I had a patient who was 27 years old. She had fibroids up to her rib cage, filling her entire abdomen like a 9-month pregnancy. And they were painful, and she had to have surgery done. And unfortunately, we could not just save the uterus in her case. And luckily, we didn't. She had a rare disorder, a certain enzyme deficiency that led to her getting that big of fibroids at her age. And this enzyme disorder actually potentially can cause her other problems down the line as well. A unique case, but I'm saying that you'll see fibroids across the spectrum of age, mainly for older people. About 40% of women get significant fibroids, 25% have surgery because of them eventually. So diet and lifestyle seems to help here too. This Adventist 2 study we already heard about earlier today, they also looked at vegan women and their risks of fibroids, and only about 60% of the average American risk. So diet makes a difference. Things in diet that maybe have been implicated are beef and ham in particular. Looks like the estrogen question again says these are estrogen-dependent benign tumors in the uterus. Having less estrogen around to influence them because you eat the right food comes back to bless your uterus as well. Okay, let's talk a bit about this topic a little bit more. Cardiovascular disease. Women have as much, if not more, cardiovascular disease as men. They actually have more morbidity, more death after menopause than men do. So it's not a man's problem. This is a woman's problem as well. And I've been preaching this for quite a few years. 60 million women in the U.S. have heart disease. Some factors in women play unique risks more than men. Stress and depression, autoimmunity. Come back. Somehow, there we go. Having had preeclampsia in pregnancy significantly changes your odds later on. So preeclampsia is a risk factor. Loss of estrogen is a risk factor because it doesn't protect the heart. We thought that was the case. The Women's Health Initiative study was done in part to prove by the drug companies that estrogen would protect your heart, prevent death, and be something every woman should take the rest of her life. That's kind of the premise of the study. It turned out it didn't do that. It did not protect the heart. It does not have any long-term cardiovascular benefits taking estrogen after menopause. But loss of estrogen may be a beginning of the process of things speeding up because in the first 5 years after menopause, cardiovascular risks go up substantially. Probably time to really double down on your diet. Women's symptoms of heart disease is not always classic. You don't always have that classic crushing chest pain radiating to your left arm with diaphoresis and nausea. They may not have all of that stuff, so we've got to be more aware of it in women. There's a thing called spontaneous coronary artery dissection, which is unique in women, where it's not like a blood clot forming in a partially plugged area that helps you, that gets you in trouble. It's actually kind of a peeling away of the lining of the artery. It's a different, unique way of getting it. The Mayo Clinic here in Rochester did a lot of unique research on that very topic. I've got a patient right now who's pregnant. She's 43 years old, it turns out. And she had this happen right after her last baby was born. And it looks like a heart attack on the EKG. You treat it like a heart attack in reality, but it's not a heart attack, and it goes away as soon as it just heals. I'm not sure what it causes that, but I have a suspicion probably related to factors that may even relate to diet. So risk factors for cardiovascular disease, well, family history, diabetes, big. You think about the fact that about 50% of the population today have either prediabetes or diabetes. That means half of people right now got a cardiovascular risk factor they didn't know they had. Smoking, hypertension, cholesterol, diet is huge. The big factors are saturated fat, added sugar, and cholesterol. Meat consumption is not just about saturated fat and cholesterol, it's also about other stuff. We touched upon that earlier, this inflammatory thing, new 5GC here, promotes vascular inflammation. Red meat does that. Bunch of things that happen from meat consumption. When we consume meat, a product in meat, one of the amino acids, carnitine here, found in red meat, bacteria, the wrong bacteria in the gut generate this TMAO, trimethylamine oxide. That accelerates atherosclerosis, accelerates hardening of the arteries and puts you down the road toward heart attack. So the bad bacteria have a bad effect. Guess what happens if you feed a steak to a vegan? Nothing, because they don't have the bad bacteria in their gut. So that one steak isn't going to get them in trouble. Don't do this, but I'm saying, my point is that, when you got good bacteria and that's what you've been eating and feeding and nourishing, you're going to be all right. Not to eat meat, but I'm saying the point is that bad bacteria cause that problem. You don't get TMAO unless you have bad bacteria. Heart disease is the #1 cause of death in the United States. It's a lifelong process in making. It starts in your youth or 10 years old, like we talked about earlier today. Not entirely genetic. It is reversible. It's rare in other parts of the world. Rare. Here it is. It's not this way everywhere. The risks are in rural China, Uganda, Crete, Papua Highlands, Central Africa. All these places, Tarahumara Indians live across the border from Arizona. We need a paradigm. We thought for a time that all we had to do is treat things more aggressively. Give people high doses of statins and high doses of sugar-controlling drugs, put them on insulin or whatever. By the way, insulin itself is a bad thing. You don't want excess insulin in your body because it's inflammatory to your blood vessels. And you get excess insulin chronically if you are diabetic because you're insulin resistant, right? Because your cells are resisting insulin, you make more and more of it to overcome that, to keep your sugar controlled. So that long-term excess insulin is why diabetics and pre-diabetics have more heart attacks. Insulin itself is a culprit. So, and that's why people that are diabetic take high doses of insulin have more death. That is not helping your heart. It may keep your blood sugar controlled, but it's not helping your heart. Anyway, those studies, there's 4 of them. It's Accord, Navigator, Courage, and Enhance. They looked at doing very aggressive treatment. Drive your cholesterol down to 150. Drive your LDL down to 60. You can do that with toxic side effects of the drugs, but you don't get a benefit for the heart. It does not lower your chances of a heart attack. So it's not a matter of better, number control. It's not about number control. It's about the whole person. It's about the whole health picture, not just about supplements and drugs. I'm going to skip by this one here. This is around the globe again. The Nurses' Health Study done by Harvard, sort of 73% lower chance of heart attack and optimal diet. The EPIC trial we heard about already today from Europe, the EPIC Potsdam trial, 81% less heart attack. Inner heart study, 80%. Look at these numbers. All these things, 73 to 80% less heart attacks, and people eat better diets. This is not made up data. This is not fake news. This is the real deal. We don't need to get 80% of the heart attacks we're getting. Can we change whole communities? Well, Finland had a big problem with heart disease because they were really going down the wrong road. After World War II, they came back and ate a lot of butter and meat and dairy, and they smoked a lot and did all kinds of stuff that's not good for the heart. And they had the highest rate of heart attacks in the world for a period of time. The government knew that and recognizing that went on a public health crusade, if you will, to change that. And after about 10 years or so, they got people to cut down their smoking, reduce their saturated fat intake, and eat more vegetables, and they dropped the heart attack rate in younger men by 85%. It's incredibly significant outcome. So we can change whole countries when the government gets up behind it. Okay, we can do this, and people get informed. Our professional organizations, the Internal Medicine Association, talked about stents and bypass surgery, which we do, of course, for folks. There's a role for stents. I mean, if you're having a heart attack, a stent may preserve the heart muscle from deteriorating. So acutely, it's an emergent measure that may help you. with things. It's not a good idea if you happen to find out you got occlusion of your coronaries, and as we've been doing up until not too long ago, you put them on a treadmill, you can see changes, you do an angiogram, you find blockage, you're 80% blocked, put a stent in that area, right? Does that help reduce the risks of heart attack or death? It does not. Stents and bypass do not reduce your ultimate outcome. So that's what they're saying right here. Lifestyle change and medical therapy should be the mainstay for most patients with stable cardiovascular disease, focusing on limiting all unhealthy behaviors. That's in 1912. It's like 11 years ago. We know this for a long time now, and so folks just don't do stents for the heck of it anymore. It's kind of gone by the wayside unless you have it for an emergency. This is a fellow who's a good friend of our family's who, 55 years old, non-smoker, family history, high cholesterol. He had high cholesterol himself. Pressure, type A personality, overweight, junk food junkie by his own admissions, had a T-elevated heart attack while on statins. He already had statins going for him. He had stents put in, the right thing to do at that point. He remained symptomatic with angina, had a second heart attack about 20 months later on standard therapies, but without diet change. I had a long talk with him, and I says, Mike, you're going to go down the road to death here if you don't watch out pretty soon here. He adopted a whole food plant-based diet. Now he's essentially tapered off most of his medications. He's still on statin drugs, of course. He says, I've never felt this better and this well in my life till I'm back in my 20s. So really a testimonial from somebody who's been through 2 heart attacks, has all kinds of risk factors for having the problem. Got to watch this video here. This is a good one. This is a clip here from a movie called Escape Fire. I think you guys got to see this is Dean Ornish's study. Another famous study about reversing heart disease.
In the last few years, a profound change has begun in American medicine.
Dr. Dean Ornish has studied and written about diet and heart disease for decades.
In medical school, I was learning how to do bypass surgery with Michael DeBenke, the heart surgeon. We'd cut people open, we'd bypass their blocked arteries, and he would tell them they were cured, and they go home and more often than not eat the same junk food, smoke, and not manage stress, not exercise, and then often their bypasses would clog up. So we cut them open, we bypass their bypass, sometimes multiple times. I said, there's got to be a better way. I've spent more than 30 years of doing studies showing that heart disease can be reversed by changing what we eat, how we respond to stress, how much we exercise, and how much love and support we have in our lives. In our model, the physician acts as a quarterback, and he or she assembles a team of 5 other people to work with: a nurse, a yoga teacher, an exercise physiologist, a registered dietitian, and a clinical psychologist. And when we work at that level, we find that people are much more likely to make these sustainable changes, and the patient learns how to empower themselves and to transform their lives.
Years ago, I had 5 restaurants in San Francisco. It was a great life. I smoked 6 cigars a day, 10 cups of coffee, a lot of wine. It was wonderful. And I had a massive heart attack. I was in the hospital for 2 weeks. I could hardly just about walk 3 steps, and I'd have to stop and rest. I was popping 20 or 30 nitros a day. But then Dean Ornish was starting his program to see if you can reverse heart disease through lifestyle change. And he went to my doctor and asked if he could approach me. He told Dean, how long is the program? So he said it was a year. And my doctor told him he wouldn't recommend taking me because he didn't think I would live the year. So he figured I was going to die because I was in such bad shape. And now I'm 25 years later, and I'm in pretty good shape.
We found that after a year, the men who made these intensive lifestyle changes, their physical heart disease improved. It caused their blockages to become less blocked in their arteries. And that was the first study showing that heart disease was reversible. But when you're doing something that has never been done before. It's not universally accepted, to say the least. It was met with a huge amount of skepticism and resistance. People say, well, you're doing this radical intervention. You know, I say, radical? Like compared to having your chest cut open? I mean, give me a break. We need to empower people to change their lifestyle. And if we can make it reimbursable, that really brings it into the mainstream. Now, as you know, heart and blood vessel diseases kill more Americans than virtually everything else combined. And it's treated with things like angioplasties and stents and bypass surgery. And yet, what does the evidence really show? Unless you're in the middle of having a heart attack, which 95% of people who get them are not, they don't prolong your life, they don't even prevent heart attacks. We have a model that works simply by making changes in diet and lifestyles.
I had to share that with you. I'm always moved by that. 25 years later, he's talking. 25 years of good life. He feels good and he's functioning and he's reversed his problems, obviously. So it's not a death sentence. I'm going to just talk a couple more slides and I think we're running out of time here, though. Is cholesterol bad? You've heard that cholesterol does not raise dietary cholesterol. Food cholesterol does not raise your blood cholesterol. True, it does not. Therefore, it's a license to eat what you want, right? Pass the cholesterol, what the heck? But before you go on, realize what happens in the body from cholesterol you consume. It becomes oxidized. When 27-hydroxycholesterol is bad, it affects the breast directly in terms of increasing breast cancer risk. It has other negative effects on the brain. And I go to the bottom here. The USDA recommendations and Institute of Medicine recommendations are regarding cholesterol in your diet. Used to say 300 milligrams. What do they say today? As little as possible. It doesn't leave many room for eggs in there. Each egg contains up by 200 milligrams of cholesterol. That's not as little as possible. Egg yolks are going to get you in trouble. Just to point out, that there's good and bad plant-based diets. We already heard that today. I'll say it again. There are bad plant-based diets. There are people say, I'm vegan. Well, great. What are you eating? Cheetos and beer. I mean, it's not a good plant-based diet. So you got to be careful here. It should be a whole food, plant-based, vegetable predominant, overwhelming kind of diet. That's what we're talking about here. This is just the study you've heard data from earlier already. There's a Harvard study here looking at sources of protein in the diet, where they hurt you or help you. On the right-hand side, things are helpful, and left-hand side, other way around. So harmful on the right and helpful on the left. So beans, red meat at the very bottom is the best benefit of all. At the very top up there, taking high-fat dairy for fish is the worst risk of all. So basically, where you get your protein from is important to know. Bottom line, takeaway message, eat plant protein. Vegetables prevent heart disease by a lot of mechanisms. They increase nitric oxide, which relaxes blood vessels, lowers your blood pressure, antioxidants, etc. This is the former president of the American College of Cardiology, Kim Williams. He had high cholesterol. He had problems with his health. So I'm not afraid of dying, he says, just I don't want to be at my own fault. The American Heart Association says, recommends skinless poultry, fish, and low-fat dairy as part of a healthy diet. How they can sleep at night, when you know all these facts, is beyond me. I mean, so the American Heart Association is off base. They don't really get the full message. They haven't gotten that memo yet, I guess. Okay, and Mark Bittman. Disturbing trends, kids are getting sick. Cancers are going up a lot in younger people. The contrast of cancers in people who are the younger generation, Gen X's versus baby boomers, it's like twice as high for many of these cancers. This is breast cancer. You can see we, North America, there lead the world in breast cancer incidence, and places like Middle Africa and China are way down there on the other side. I'm going to move on here a little bit. Gut microbiome plays a role. Risk factors, dairy milk is significant. Benefits for cancer. Soy, beneficial. Whole food, plant-based. Exercise. Getting carotenoids, orange and red pigments in our diet. Those carrots and that pepper, squash and sweet potatoes are what we're talking about. I thought I heard soy causes cancer. We talked about that already, but basically here we find that there's about a 30% reduction in breast cancer risk if you consume soy regularly. Warning, hot dogs can wreck your health. Well, processed meats, of course, contain nitrates. That's why you don't buy green weenies, because there's nitrates in there. They stay pink forever. And the point is that this is a a risk for your health. Parting truths from Dr. Katz. There are fundamental truths about diet and health, truly. The truth about food is simple. The lies are complicated. Eating well is simple but not easy. Good answers to bad questions are bad. Eating well can add years to your life and life to your years. Eating badly can help kill you, generally slowly and uncomfortably. And we can love the food that loves us back, so why should we do anything else? Final slide. Grant yourself grace and forgiveness. We're not perfect. Anybody on a journey to becoming a better eater, a better lifestyle, you don't need to do it all at once. It's not a bad idea, though. I think we heard this morning from our diabetic doctor that for some things, it's just good to go 100%. And for many people, it's the right answer. Or you compromise and let yourself off the hook, and a little bit of this doesn't hurt. Moderation kills, bottom line. So for some things, probably just move ahead. It's easy to say no to some things. I don't drink soda anymore. I drank a ton of it in my lifetime, but not for the last 20 years. I just don't have a problem. I don't struggle with it. I won't say I wouldn't enjoy a can of Dr. Pepper anymore, but I just don't need it. I don't do it. Saying no is easy. So enough said. I think we're out of time. I'm sorry, we have a stretching. Okay, thank you.
Thank you much, Doctor.